Hi guys, it's Laura and welcome back to my channel. I got braces off. That's really cool. So today's video is like not exactly something that everyone will probably want to watch, but I think it's something that will help someone out there. And if it does, then that's absolutely great. I've done my bit, you know. Um, so this video is going to be 15 things. I must admit number 15 is a bit of a cop-out because I didn't want to have 14 things, I want to have 15. 15 things I wish I knew before taking isotretinoin or Roaccutane or Accutane. So this is what they look like, this is what I'm on. I'm on 30 milligrams, I was on 40 for a month. And then they lowered the dosage again basically. So I've actually made a list, like I've written quite a lot. On my really cute owl clipboard. So what I've done is I've actually written about it. I've written what the tablet is and what it does, because I think when I got put on it I didn't really know what it did. So I've been on it for 7 months, and hopefully after this month I will stop taking it. But this is basically just things that I've picked up that necessarily doctors didn't necessarily tell me. Right, so what Roaccutane or Accutane isotretinoin is, this is kind of like fact number one, I guess. So there is no difference in what they actually are. People will call them different things. I think my doctor called it isotretinoin, and then the consultant at the hospital called it Roaccutane, and I think Accutane is possibly an American term for it. I'm not 100% sure, because I've never had that used with me. So basically there is no difference in them. So as you can see, mine say isotretinoin there and then Roaccutane. So I'm pretty sure that isotretinoin is the brand, no, is the actual tablet, and then Roaccutane is like the brand name for it. So there actually isn't any difference in them. I had to Google that myself. What it is it's a synthetic vitamin A, and I will show you the tablets again. So you get a month's supply at a time, you can't like get a repeat prescription of it. So that's what the 10 milligram one looks like. Really not very big at all. They're very soft, they're not like a hard tablet, which was what I was expecting. I was expecting something like kind of like a paracetamol or something like that was what I was expecting. And then the 20 milligram one, it used to be purple, and then for some reason this time they give me a different brand. So this one is pink and white, and they're really pretty, to be fair. They're very nice colours, which I'm glad about, because who wants to take ugly looking tablets? They don't really have a taste or anything. I find them easy to swallow, but some people might not. So it's a synthetic vitamin A, and it's part of like a retinoid group, and it's for severe acne. And I'll find, if I can, some like kind of before pictures of what my skin looked like before. So basically you have to get referred to it by a doctor. You have to get referred to like a proper dermatologist at a hospital, and you'll only get prescribed it if your skin doesn't respond to like other antibiotic treatments. So my acne wasn't necessarily severe, but it didn't respond to, like, I think I was on 3 different antibiotics. I can only remember being like on 2, but I'm sure there was a third. So I think the doctor tried limacycline first, then I think the doctor tried something else, and then when I went to dermatology they gave me oxytetracycline, which was just kind of to like, I think that was a stronger antibiotic, so they were like, if it doesn't respond to this then you're going to be put on something else. So what it does, how it works, I never actually realized what it did necessarily, was it shrinks the oil glands in your skin. And obviously like the oil glands in your skin is like kind of what causes the acne, I guess. So that's how it works. It just shrinks your oil glands. Um, so I had it on my face and on like my back and my shoulders. I don't have any pictures of my back and shoulders because I didn't really want to take before pictures. That was nothing I kind of thought to do. So I'm gonna go through my list now. Okay, number one is that they take a few weeks to start working. So I think on the NHS website it says 10 days to 2 weeks to start working. So for you to actually start seeing the effects of it, but you probably won't see anything straight away. Like it might take a month or so just for you to kind of think, oh right, this is like what it's doing, this is helping. It's not something you're necessarily gonna like take your first pill and it's gonna be like, wow, my skin is clear. You know, it does take a while to work, but it does work, I promise. Number two is that anybody who is capable of becoming pregnant needs to either be on some form of contraception or kind of sign like a contract basically promising that you won't get pregnant. And it sounds really stupid, but it's because I think it's the amount of vitamin A that you take, it can be harmful to like an unborn child. So you also can't give like blood or anything, because if you give blood and that blood goes to someone who is pregnant, then you could harm their baby. So normally, I think they normally just suggest like the pill or something. And number three is, wait, I've done number three. Never mind, this is 14 now. No, it's not, because I did one before. It's still 15. We're on a roll. Number four, we've skipped over number three, is how much you get depends on your weight. So I think the most they could give me was 50 milligrams. I never got 50. I got 40 at the highest and then just stayed around 50 consistently. I've not had a drink in many hours, so that's why my voice is going a bit funny. So I think the last time they weighed me, which was a few months ago, I would think I was either 53.6 kilograms or 56.3. I get the 3 and the 6 mixed up. I'm not going to weigh myself now because I can't be bothered. But you know, it's one of those things I think your body just can't take so much. Number five is that there are a long list of side effects. I will get something out and I'll show you the amount of side effects. So your possible okay, so the side effects start here, this line here, and they go all the way down here and all the way down here. So that's all. That is your list of side effects. There are loads and loads and loads of them, but that's not something you should really worry about because you will only get a few of the mild ones, maybe one of the more moderate ones. I think I have. Hold on. Let me. Common side effects: higher levels of cholesterol in the blood. Now they've seen that with me. So they just monitor that. They don't really cut anything down. I don't think they just kind of monitor it to make sure it's not too high. For whatever reason, my side effects aren't on there, but they're on the NHS website. So I think I have dry lips, dry skin, dry eyes. Dry eyes is a killer. Oh my god. Dry eye spray, £6 from Asda's own. Spray for dry and sore eyes or something like that. Lifesaver. Don't get one of the really expensive ones from like Boots. Don't need them, Asda works. Vaseline as well for the lips. Vaseline, if your lips are really dry, like mine can get dry so much that I can't like smile more than like that, or my lips are gonna like split. I can feel it. So for when it's like that, I put on Vaseline, and I put on Vaseline every night. And apart from that, I use this moisture stick, the little moisturizing blue stick from Superdrug. I got this in December last year. I've used a lot of it. But it's so useful because they're better in the long run for your lips. Like they're going to keep your lips hydrated for longer. So they're very good. I would recommend that. 99p. Again, you don't need to get anything too expensive. Moisturizer as well. Just any will do. Maybe don't get an oil-based one. Maybe get one for dry skin because your skin is probably going to get dry. And I also get like back and muscle pain quite a lot. Like if I'm like standing up and then I sit down, it takes like a minute of just pain for my back to just kind of adjust to what it's doing. But you get used to them. You won't necessarily stop noticing them, but you will get used to them. Number 6 is that you will probably get blood tests every few months. That you get one before you start to check that you're okay to start, like kidney problems, liver problems. Just they look for certain things just to make sure that they know what level you're at, so that if they rise, then they can see that. And also, if you're at a good level, like if there's something wrong with your liver, they might not give you it, I think. I'm not too sure. Don't quote me on that. My liver was fine. So if you're scared of needles, I never had a blood test before, and now I've probably had about 6. But it's not actually that bad. Like, you probably get really nervous beforehand, but it's alright. Like, they're very kind. I'm kind of in between pediatrics and adults because I'm just kind of, I'm 17. I'm at that age where it's like, what category do you put her in? But the pediatric nurses are so friendly. They're so nice. They like just trust in your doctors and stuff, like, because they know what they're doing. Number 7, there are things that they do not tell you necessarily because of your age. So obviously the legal drinking age is 18, so I didn't get told anything about alcohol. You can't really drink alcohol. You have to really limit your alcohol intake, because it can damage your liver. Is it your liver? I think it's your liver. But it can be quite bad for your liver if you're like drinking, and then that can damage your liver, and then the tablets can damage your liver, and then your liver's gonna mess up really. But they didn't tell me that because I'm under the legal age for drinking. But I know a lot of people do drink underage. I'm not really that big on it. But as well as that, you can't wax because your skin's gonna get really sensitive. And you have to wear sun cream. Now, they did tell me this, and it is written on the box. Is it? I'm trying to like cover everything. Okay, so it says to avoid sunlight. Protect your skin from sunlight, even on a bright cloudy day, and don't use sunbeds. Because it's just bad for you. It's going to harm your skin. So my moisturizer is for, I think it's for oily skin because I bought it a while ago, but it's also an SPF 30. So that is very good because you've got your sun cream in your moisturizer. Google stuff and read the information leaflet. I don't always recommend Google as like Bible, you know what I mean? Like, it's not always true. But I think with a lot of things, if you go on like doctor websites, if that makes sense, like, is it WebMD or something, or the NHS website, my personal favourite website, they tell you a lot of things that you might not necessarily be told by the doctor because they might not think it's relevant to you. Just make sure, like, yeah, if you're going to do something and you think, oh, will this be affected by my tablets, just Google it, give it a quick check. Number 8 is that it mostly clears up your skin. You might occasionally get like small spots. Like this morning I woke up, you can't see it, is it gone? It's gone. But I woke up with this really random red mark on my face, and I don't know where it came from. It wasn't the spot, but it was like, might have been a spot, I don't know. It was really weird, but it's gone now. But you get like the occasional spot. It's not going to completely 100% clear your skin. It clears up the bigger spots that are, I think they call it cystic acne, where it's like basically the worst of it should go away. Like, you shouldn't be getting like big spots and stuff like you did before. Number 9 is that have I said this before? No, I said contraception thing before. You're most likely to get monthly pregnancy tests if you are capable of becoming pregnant. You can refuse these pregnancy tests if you really are against it. It's not bad. It's not like something to be really scared of. Number 10, you have to stay on it for a month after you want to stop. So I wanted to stop last month, but you have to kind of just make sure that it's all gone. So I think it's all gone. Like, I have no spots. I have one weird spot that's like on my arm. I am wearing a top, I promise. It's like kind of here. You can kind of see it. And she said that's not really like something to worry about. I've had that for like a month or more. It's really weird. It's just not gone away. So she was like, nah, that's okay. So I went down to 30. I was on 40 last month and I went down to 30 just to, because I thought it's gone. So I may as well go down to 30 so I'm like not getting as bad side effects. So yeah, you have to sit out for 1 month, but it's just a month, it's fine. I've already talked about your skin being dehydrated, which is really annoying. You can't use vitamin supplements. So you can't take like, I think you can take other vitamins, but not vitamin A, because you're having a really abnormally high dose of it anyway. So having more, yeah, you don't need more. I promise. Number 13, because I skipped number 11. Very important to raise any concerns you have with the doctor. So if you find something that's like abnormal, phone's gone off. Okay, I can't remember what I was saying. If anything is different, if anything at all has changed, if you're like losing weight, if you're gaining weight, anything like that, just make sure you tell your doctor if you've got any concerns, because a lot of things, this ties in with number 14. So a lot of things can be caused by that. Like I've been feeling very sick recently. I've been running. I'm feeling very sick recently, and when I talked to a doctor about it, I told them I'm on isotretinoin. Will that could that be a factor? And he said, well, it's actually quite notorious for causing sickness, so just make sure that you mention it, because it can cause a lot more things than you might originally think. Just yeah, make sure that they know, because honestly that they're probably going to be like, yeah, it might be that. Just yeah. And number 15, which is my cop-out answer, is that you always have to take it with food. You have to take it after, I think you have to take it after a meal. You're supposed to take it after a meal, because I always have it after my tea or dinner, whatever you want to call it. I always have it then, because it has to be digested with like fats or something like that. I don't know, I'm not sure. Give me a minute, let me, yes, this is really long. Please don't be alarmed by all of this. I haven't read through it all, to be honest, and in 7 months I have not needed any of that information really, apart from the side effects. Side effects are very important. But yeah, that was my 15 things that you need to know, or I wish I should have known. I wish I knew before taking isotretinoin. And you'll probably find a lot of things as you're on it. You'll probably find out lots of different things about it. It's kind of big and scary, but it's not really that big and scary. Oh, I should have said this. Okay, this is actually a very important one. They will test you, well, not test you, but they'll ask you if you have any history of like things like depression or low moods, just because there is a chance this can make it worse. So yeah, just make sure you tell them that. They're probably not going to say, oh, you're not allowed to go on it. They'll just monitor you more closely. They'll probably just like double check. They always ask me when they give me more, they'll always say any depression or low moods, and I'll be like, no. I hope it helped someone out there, and if it did, I'm very glad. Comment if I've missed anything, if you think I've not included something that was actually really important and you think other people should know. And also comment if you have any questions, because maybe I've just missed something out that you really want to know and I could just answer that question for you. And if not, then I will try my best to find an answer somewhere on the internet, but don't, again, don't completely trust that, because it is off the internet. But yeah, like if you found this helpful, and I will see you in my next video. That will not be about any medication, I promise. It'll be normal video. Okay, bye.